Welcome back to Autonomy School. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. Today's discussion is on self-directed learning, how to empower medical learners. This is the famous quote of William Osler. The hardest thing to get into the mind of a student is that education upon which he is engaged is a life course, for which the work of a few years under teacher is only a preparation. Many times the students and teacher forget that. The importance of a teacher should disappear with the time, and he should no longer be required for the students. If every day he is required, that means he is not a good teacher. That is the point I would like to stress here. Going into the history of SDL in the Western world, this started with the book by Cyril O'Hole, The Inquiring Mind, a study of the adult who continues to learn. And his students, Alan Dow and Malcolm Knowles in 1975, brought out the book Self-Directed Learning, a Guide for Learners and Teachers, the first edition, following which self-directed learning came into the Western world. In the last session, we have discussed about the type of learners, visual learners, auditory learners, kinesthetic learners, mixed type of learners. And here I am going to discuss the stages of the learners. Stage 1, as we know, is a very dependent student. He is dependent on an authority. He needs coaching. With immediate feedback, drill information, and the deficiency should be overcome immediately. If at all there is a resistance, it has to be cleared also. So this is the authoritative teacher. Many of the so-called well-known teachers are like this. And the problem with them is that they fail to make the student a good learner. And the student always requires a teacher for any purpose. The next stage the student should go into is the stage of an interested learner. Here the teacher's role changes into a motivator or a guide. An inspiring lecture followed by guided discussion, goal setting to the student, and giving them strategies for learning. That is the. And the third stage, the student goes involved in the learning process. The teacher's role changes. He should be a facilitator, discussion, participates equally with the student. Examples are the seminars and group projects. And the ultimate goal is a self-directed learner. The teacher should be a consultant or a delegator. So the role comes at the time of internship, dissertation, individual work, or self-directed study groups. All these are self-directed learning techniques. Our aim should be a minimum. We make the student involved, and later they should be able to go into the self-directed learning. By the lectures, what we are doing is that we make the student dependent on your lectures. So the learning objective today is definition of self-directed learning, explain the rationale of SDL in CBME, identify the roles of faculty and students, and give an example of an SDL and how to conduct it effectively. For many, they think that SDL is a very new concept. But remember Egalivia. He set his goal, he had his own strategies for learning, and he became a good archer. So Ekalavya may be considered as one of the a leading example of a self-directed learning. So, why do need SDL in medical education? Because it promotes a lifelong learning, because an Indian medical graduate is a lifelong learner. So it encourages active engagement and curiosity, and the student will become a critical thinker and he will be able to solve a problem. That is why it has been included in the CBME curriculum and NMC guidelines. So now let us go into the process of SDL. First is identification of the learning needs. So the student should be able to identify the gaps in his knowledge. Secondly, he should set the objectives either alone or with the help of the teacher. And the teacher should identify the resources, and there should be an implementation and a learning phase. That is, in the learning phase, it should be implemented. And you should not end at that level. You should have reflections and feedback, and finally assessment and documentation. So, what is the role of student? The student should identify the gaps, as already mentioned. They formulate the goal, what they should learn. Actively engage in the learning process. It should be reflected in groups, and the learning process should be explained and participate in discussions and assessments. Then only it will be complete. I will give an example of an SDL session. The topic may be stroke in the young. Better to conduct it as 2 sessions. First is a pre-session orientation. The faculty in charge should explain the objectives. He may give a case, either a case in the ward which the patient that they can go and see, or you can give a sample scenario, and then set the goals. What are the objectives? Should tell. The students may be divided into subgroups, and the topics may be subdivided. For example, if it is a young stroke, the cause of young stroke, the presentation, the investigations, the interpretation of the CT scan, something you can subdivide and give to the student groups. Then the learning process, you tell, you may go and search this textbook, Harrison's, or some related books up to date, or some other sources from the internet. You can give some videos, either you select good videos from the net, or you can prepare video and give the students to watch and then prepare notes. Then they should reassemble the next session. Preferably the interval should be around 1 week. The topic should be given in well advance, and they will have group discussions. If the subtopics are given and subgroups are there, they can have interaction, they can have questions in between, and finally they will come, they may present it as a seminar or down-at rounds, about which I will discuss later. We can arrange for a reflection and finally assessment. So what is the role of faculty? I already mentioned, he should be a facilitator. Don't think that self-directed learning is a process done alone by the student. The teacher has got an active role. He should guide them. He should be available, something like a mentor. And he should see that they are aligned with the learning outcomes. So should not be too deep into some areas which are not required. Provide credible resources and structured learning process. You should encourage the reflection either by peer group assessment or self-assessment. They should do evaluate how they participated in. You can discuss along in the group how each one, or what were the roles of each of them, and that is you should have how they participate in the learning process can also be assessed, and again their understanding of the subject. So both ways we can assess. So assessment in the SDL can be formative assessment. Example, reflective logbooks. As mentioned, peer and self-assessment. We can get feedback from the facilitator, arrange for short quizzes, MCQs. Viva can also be conducted, or as I have mentioned, rounds can be arranged. The students will be facing each other and then ask questions. Then there can be summative assessment. What are the challenges and solutions? Lack of motivation for students and faculty. So you have to give orientation to the students and guide them. Poor resources. You should facilitate the students to utilize a library or other learning sources. Time constraints. That is one of the problem with the SDL. It needs some time. So scheduling flexibility. It can be done in 2 or 3 sessions. Most important, faculty resistance. It is always the most important. The most common problem is any change will be opposed. So we should arrange for faculty sensitization and workshops. So reflection in SDL. What did I learn? How did I learn? What challenges I face? What will I do differently next time? So this is how we arrange the reflection. The best practice is begin with a small, simple SDL module. Give clear learning outcomes. Give structured feedback and integrate reflection and assessment. Examples of SDL topics in medicine. You can give hypertension, the lifestyle and pharmacological management, hypertensive crisis. Stroke is a very important, very useful topic. Recognition and prevention, imaging findings, acute management, anything can be taken. Diabetes, COPD, fever with rash. And again remember, SDL is topics. What we should give is, our plan is clinically relevant topics rather than very rare theoretical things. These are my references.